Hi, the title of this presentation is Connectivity Changes in Tremor Network Associated with Unilateral Focus Ultrasound Thalamotomy. It's part of our work at Ohio State University. So the localization of brain lesion in patients is used to define the anatomical functional maps. Modern lesion mappings utilize functional magnetic resonance imaging to precisely define clinically relevant brain networks, as described in paper by Michael and Fox. Tremor network implies that the brain network underlying the pathophysiology of essential tremor, and this has never been localized using functional MRI. So with this presentation, we want to aim to define the tremor network by mapping focal ultrasound thalamotomy lesions and determine the changes in connectivity in the tremor network before and after lesion. We have 30 left-sided FUS lesions for 75 subjects in the human database. We have also significantly connected to all the lesion tremor network extracted from a connectivity analysis.
We analyzed 24 cases with essential tremor, 26 controls. Testing the hypothesis that functional connectivity was significantly different in tremor network in essential tremor patients. And we also compared for the AT patients we found out that the tremor network was comprised of 18 clusters. Some of them were previously known, like the contralateral cerebellum, lobes 5 and 6, ventrolateral thalamus, bilateral primary sensory motor cortex, and others were new from the previous literature, the globus pallidus, bilateral occipital cortex, and left osteoparietal cortex. Also, the AT patients had significantly higher connectivity in contralateral cerebellum, ipsilateral thalamus, and bilateral sensory motor, and ipsilateral premotor cortex. The connectivity decreased after focus ultrasound in the contralateral cerebellum and ipsilateral motor cortex. This figure shows the tremor network, the main clusters. In this figure shows the results of the cases versus control comparison at baseline. And this shows the comparison between baseline and post-focus ultrasound ablation. The blue color signifies a decrease in connectivity, and the yellow-orange color signifies an increase. So in conclusion, we show that the AT patient compared to the control has significantly higher connectivity in the cerebellum, in the thalamus and sensory motor cortex, and after ultrasound the connectivity decreased, especially in the sensory motor cortex and the thalamus, while after lesion the connectivity increased in the putamen, globus pallidus, superior temporal gyrus, and middle occipital gyrus. So we conclude that unilateral focus ultrasound partially restores functional connectivity in the tremor network.